It was first described in 1976. You notice that there are about 6 strains. Introduction to humans is through contact with fluids, secretions, and blood of infected animals. It tends to have very high case fatality rates. In fact, in the 2000 outbreaks that occurred in northern Uganda, more than half of those infected died. There's also potential of spread, particularly international. There will be more support to Johnson & Johnson and to Merck to produce more vaccines.
This information be found.
There are papers on Ebola being published almost every day.
How prepared really are we?
There are discussions that are going on, especially with regard to issues of surveillance. There's yet to be training to be undertaken. I don't think there's any training so far that's going on. So I don't think we're that.
Then do you really think we have deployed any kind of specialist personnel, especially at the borders of Busia?
And I know some screening is going on, at least in Busia and Malaba.
My name is Patrick Miruka. I'm from MedicScan, AfricaScan.
Tonight, we will be discussing on the Ebola virus disease, the vaccination, treatment, prevention. To help us understand this disease is none other than our presenter, Dr. Ombeva Malande. He's a vaccinologist and senior consultant, pediatric infectious diseases.
Ebola, of course, falls in the group of diseases called hemorrhagic fever. It was first described in 1976, and this was done near the Ebola River in the Democratic Republic of Congo. Transmission generally can come from all those animals you can see I've shown there. Fruit bats are thought to be the natural hosts, and they usually have asymptomatic disease. Introduction to humans is through contact with fluids, secretions, and blood of infected animals. Could be the chimpanzees, gorillas, fruit bats, forest antelopes, and porcupines, and causes simian hemorrhagic fever. So animals really, the Zaire strain can go as high as 90%. Pregnant mothers if they contract Ebola, they're more likely to die. And the bigger challenge, of course, usually is also tracing of contact. It takes a while before you detect. It takes about 7 to 10 days. A person may have the disease and is moving around. Can then now really spread it so fast among themselves. And that is really where we get the problem, because it's that direct contact. It may be fluids, it may be organs, blood, secretions. Those are the ones that then make the disease spread so fast. It's not transmitted through water or air. Progress initially, of course, like I said, you begin with a very non-specific syndrome. And then somebody gets flu-like symptoms, fever, body aches, tiredness, nausea, vomiting, diarrhea. In about 6 days into the disease, the person can then become contagious. Now, the whole incubation period, the disease could develop for anything between 2 days and 21 days. Again, depending on strain. Like I said, the Zaire strain, which is very dangerous, the progress, of course, is faster. And once the disease has progressed into the person, where the problem is when the person now begins to get bleeding with a shock, failure of organs and systems. There are some who actually recover if intervention is rapid, quick. That's why contacts have to be monitored, because then you can easily pick those who are developing signs and you immediately begin to institute recovery protocols. So people can recover if they are immediately supported, especially if efforts are made to avoid shock, because shock is really the worry. And there are people who recover and can have virus persisting in them for many years. Strategic actions addressing Ebola virus disease in outbreak situations. Other things, of course, will ensure that how do we make sure that essential services continue, food, mobility of people, cash incentives for health workers to support them, providing good isolation centers.
Question from a participant. I think I am enjoying. Are there any recent papers on Ebola, any published in 2022? Maybe you can be able to address that.
There are papers on Ebola being published almost every day. If you do your search, because remember the outbreaks going on in West Africa. There are studies that are going on, longitudinal studies I've just mentioned. We have a huge trial that is following up former survivors in West Africa. So it depends on what kind of information you want.
What is the preparedness in Kenya on Ebola? Any practical Kenyan COPs in anticipation on Ebola reaching here? Where can this information be found? Maybe you can talk about a little bit before we continue with the conversation. What are the kind of, from your own perspective, the kind of preparedness that is in place?
So in Kenya, we have been having meetings. The Ministry of Health set up an Ebola response committee to prepare, which I do belong to, and with a very heavy representation from both the academia and the Ministry of Health and the health and the infectious disease associations, both from pediatrics, from where I come from, the Kenya Pediatric Association, and my colleagues also, Christine and the others are there, and the Physicians Association as well. And what we are doing is the conversations that we've been having are looking at how do we ensure that we are better prepared in terms of three things: one, surveillance; two, outbreak response and setting up teams, particularly for border districts; and three, looking for vaccines from the stockpile or sourcing elsewhere.
Dr. Yonga, are you with us?
Yes, I'm available.
Yes, if you could just also just add on to what Dr. Mbeva has said from the Kenyan context. How prepared really are we? You remember we had this conversation when we were starting with COVID, and now it's about Ebola. Are we still waiting for us to get Ebola patients for us to start working on it, or are we actually having some prepared measures?
Well, that's a good question. I mean, I have to put in a disclaimer that I am not involved in any of those discussions, so I may not be very privy to what could be discussed. What I'm hearing, at least from some of my colleagues who are involved, is that there are discussions that are going on, especially with regard to issues of surveillance, issues of how do we screen people at the borders, and then also how do we access some of these vaccines, or even how do we tailor make some of our trials to also capture, or how do we order for some of these vaccines? That's what I've heard. But in terms of, in Kenya, we talk of issues core ground, what's happening on the ground. And I think, to be very honest, speaking with people on the ground, there's yet to be training to be undertaken. I don't think there's any training so far that's going on with regards to, how do you manage an Ebola patient? How do you don and off? How do you, remember the last time people saw patients with severe COVID was, I think, a year and a half ago. I'm sure by right now people have forgotten how to, undertake some of these infection prevention measures. I don't think that training is taking place, to the best of my knowledge. At least in Nairobi, I know none of that is taking place, and I know also in Eldoret, none of that is taking place. So in terms of preparing health workers to deal with that, because ultimately they're the ones who are going to treat these patients.
I really think we have deployed any kind of specialist personnel, especially at the borders of Busia, or rather the borders that border Uganda. Do you think there's any plan of that sort to at least have people getting screened at the borders?
I think from what I understand, I know some screening is going on.
Is there a role of statins in EBV? Dr. Mbeva?
Yeah, so that's a very good question. I think that will be case by case. That will be case by case. Remember, we have said that, and I made a very important point, you treat the symptoms as they arise. So if the patient is not in pain, there's no need to give high pain medication. If the patient is not vomiting, there's no need to give antiemetic. Same applies to statins. But there are those that will be standard. Like I said, your biggest focus is volume. Inotropes, that's why I emphasize that, because of shock. Volume, blood, fluid, crystalloids, all of those.
How long does it take to test a person for Ebola and get results?
You may need 24 to 48 hours to get your PCR results. But in the mobile vans that you have, within that day, you can have the results. For the antibody test, within 2-3 hours, you should have the results. The biggest challenge is sample collection, processing, and transport.
Is the relationship between sexual libido, sexual intercourse, and Ebola? What's the effect? Dr. Mbeva?
Ebola is transmitted sexually. And even when one has recovered, it hides in the testicles and in the semen and in the prostate. So you need about a year. And we actually have documented cases of people who suffered Ebola in West Africa, recovered, declared cured. They went to the West and started transmitting Ebola. So initially we thought it would be 3 to 6 months, but I've seen new guidance saying up to a year.